This is a podcast between doctors and friends. Today's episode, we will discuss colonoscopy. I'm about to have my colonoscopy this week. Um, Dr. Ray, you had mentioned that you've had yours. Uh, Give me some tips.
Yeah, so I had my colonoscopy about a month ago, and I definitely did not want to do it. Even as a physician myself, I was very hesitant. Um, I was did not want to do the prep. I did not want to go in to get a procedure done. I didn't want to take a day off of work. It was, excuse after excuse of not wanting to do it. I did a Cologuard test, which is the test that you can do at home, where you basically, poop in a bucket and mail that into the and they test it to see, but it is not nearly as good as a colonoscopy is. I think it's meant for people who do not or cannot or will not do a colonoscopy. So I sort of thought, well, I'll just do it and see. And I did it and it came back negative. So I thought, I was fine and I won't need to do this silly colonoscopy thing because I really don't want to do it. Um, but, unfortunately, I had a very, very close friend have colon cancer, and that sort of changed my perspective. And then I signed up and went to the GI doctor to get the make the preparation for my colonoscopy, and I did so with sort of a scowl on my face and the attitude of I don't want to do this or to do it, so and I did the process and I went through with it. So I do understand hesitancy from people that when and why they don't want to do it. So it can be very, I can't think of the word, but just overwhelming to sign up and to think about doing this. So I can definitely empathize with you about a little bit of fear that you potentially have.
Yeah, I mean, my doctor had been telling me about to do Cologuard for many years, but I just can't. I can't do that part. What do you think, Dr. Foss?
Well, I do think that this is a really important conversation to have because from what I would call the literature now, I don't remember the exact numbers, but I believe that the majority of colon cancers, when they're diagnosed at an advanced stage, and that really reduces survivability. And we have clear research evidence that doing colon cancer screening, particularly colonoscopies, absolutely saves lives. Colon cancer, when it's caught early, is very fixable and treatable. But I agree. I have conversations as a physician in primary care with patients about colon cancer screening all the time, and there's a lot of resistance to it. I think there's a lot of misunderstandings and misconceptions and just all kinds of barriers to it.
Yeah. So, like I booked my colonoscopy. No, my consultation with a GI um, maybe 3 months ago or more. Uh,
More, I think
yeah,
that
right.
was
And it took
more, yeah.
so long. Why does it take so long to you just even? Uh,
I believe, once again, this is
yeah.
older data that I remember from many years ago, but I believe if every gastroenterologist like was working like doing colonoscopies 24/7, 7 days a week, like there would still be a long wait. It's just that it is a true procedure. It's not surgery. That's what people need to understand.
Uh huh.
And and there's such a need, especially, as people get older. It's not usually something that is done for screening in younger people. Um, but I mean, that's really relative. You know, if somebody has zero risk factors and their health is good, they should start screening at age 45. That is a little bit of a change from a few years ago where the screening age was 50.
Hold on, Doctor Ray.
And
How you? Hold on, Doctor Ray. How you doing there?
I'm good. I got disconnected for a second.
That's okay. That's cool. Doctor Ray was on call, so that's the life of a doctor. Well, Doctor Ray. Go on. I'm sorry. I'm sorry to cut you off, Doctor Paz.
oh, that's okay. And so there's welcome back, Dr. Ray. There is just it's just difficult, and there's a lot of misconceptions, you know, and I think, but we do know that colon cancer screening in some capacity saves lives,
Okay,
particularly colonoscopy.
so I have a question here. I had to, book an appointment with the GI for consultation, and
Mhm.
then that doctor then booked me a colonoscopy. But then I know
Correct.
someone kind of just through their health insurance network just directly booked a colonoscopy. Like, what's the difference between, you
There,
know?
it depends on people's insurance is one of them. Like some places require a referral for colonoscopy, and some places, if you have like a PPO open access insurance, some GI places will allow you to book with them, you know. But what I think also a misconception amongst patients is like if me as a primary care physician, if I have somebody comes in and say, oh, you know, you're due for colonoscopy, let me refer you, they often think that I'm just sending them straight for a colonoscopy, kind of like if I was sending you for a blood test or something.
Yeah,
And really, technically, it's a consultation with the the colonoscopist, right? Which is a gastroenterologist physician who is a physician who's specially trained to take care of diseases of the gastrointestinal tract and perform procedures like colonoscopies and endoscopies and all that stuff. And so there's usually a bit of a consultation for that physician to determine, are you a good candidate? Do you have any medical things that would get in the way where this would not be safe for you? Is this, you know, is this an appropriate thing to do? But that process, that initial consultation is sometimes streamlined nowadays where a lot of places will have like an online questionnaire. And if everything is no to all of these things, then you can just book the colonoscopy.
yeah, yeah.
So
I
there's a bit
actually,
of an evolution in that.
yeah, I was a little bit frustrated in the beginning, but I actually appreciate that I saw a GI prior to it because now she wants to do a twofer, endoscopy and colonoscopy. So I
Right.
said,
There are, which is fine, you know, for your situation, I think that's
yeah,
reasonable. And I don't have an objection to it. But in the United States, there is no recommendations for routine endoscopy screening, which is a camera down through the mouth and throat into the stomach for otherwise healthy people. There are certain recommendations for screening in certain populations depending on somebody's health history. And it is handled differently in other parts of the world where there's a higher rate of other types of gastrointestinal cancers.
mm,
But, you know, once again, I think that your gastroenterologist was doing this based on your health history.
yeah, yeah,
I
and
also think it's I also think it's very reasonable to see the GI doctor prior. I'm not aware of anybody who can just book a colonoscopy straight without ever talking to or meeting the doctor. And I'm not sure I would recommend that because it is a procedure, it does have risks, and you can decide whether you want some sort of sedation or you want to be wide awake. And so there are questions that need to be discussed, and the procedure does need to be explained as well as the prep does need to be explained. So, and everybody has different risk factors. Everyone has a different family history. Everyone has different medical history. And talking to the GI doctor prior will allow them to understand more of what you personally need. Like, for example, I only needed the colonoscopy, but you need the endoscopy and the colonoscopy. So I would advise everybody to see make the consultation with the GI doctor, go in there, talk about your history, schedule the colonoscopy, and then get the colonoscopy done.
Got it. Well,
Yeah,
you know.
I don't, there's always going to be a type, some sort of medical assessment
Uh,
prior to that, but just how in depth that is, I think depends a lot of the patient population. And I think some of the GI groups that I've been seeing doing this, where they have, you know, the patient goes, they fill out something, and they can kind of they book their question. It's like once again based on their health history, like they have no X, Y, or Z, like they're otherwise healthy people, not taking blood thinners, you know, whatever the situation may be. In some ways, I respect that for just the one reason that we can get more people screened. But I agree that, you know, it's probably safer in a lot of circumstances to have a discussion with the colonoscopist. And also a lot of GI groups are using physician extenders, like a physician assistant or a nurse practitioner to do the initial assessment. Like, why are you here? I'm here for colonoscopy. What's your medical history? Do you have any issues, any complaints, or what meds are you on? Okay, this is how the procedure goes. Do you have any questions? Do you want to proceed? Okay, and then they can have you go ahead and have the colonoscopy schedule.
uh, well,
I think it's better to talk to, I mean, I want to talk to the person who's doing my procedure. That's where I think it's weird. Like, and that's something that I think is important, is like I want to get to know them.
okay. So we have a raised hand here. Uh, Jareed, welcome to the show.
Hi, thank you. Actually, the one thing I was going to say is that I think just society scares us more than we need to be. Um, as
Yeah.
with everyone, that has shared their experience, I was terrified and horrified, right? Terrified because I'm like, oh my gosh, this is such an invasive procedure, and horrified because of just what the procedure is, right? And I had, like you, I had postponed it for a couple years, and then I do my annual, I actually do go to the doctor on an annual basis, and one year she just basically said, no, you're really, like, she was very gentle in pushing me and encouraging me to get it done, and she talked me into it. And so I was like, again, terrified and horrified, and the weeks before. And then once, in retrospect, it was like such not a big deal. Like, I met with a GI, he explained to me everything that was going to happen, why we were doing it, all of that. And then I did get sedation, and so we were in the room, and everybody was like super supportive. I went to sleep. I woke up. It was done. Like, it really was. I think just society just tells us to be more scared and horrified than we need to be, because it really wasn't.
So it's like, is it like better than a root canal, kind of?
Yeah. Oh yeah. Like, it was
There you
really, at least in my experience, it was literally like I went to sleep. I woke up. It was done, and there was
Well,
no like
that's
side
the whole
effects.
point. I mean,
There was
no one's trying to make anybody uncomfortable. You know, like
go.
everybody in the medical profession wants everybody to get screened appropriately because, once
right,
again, it's one of those tests that saves lives as opposed to tests that people walk in wanting because they think it's helpful and it's not, or maybe harmful, or that's a whole other discussion.
right.
But no, I think that's great that, you know, and barriers should be removed. And I think, you know, that's one of the reasons why a lot of GI groups are kind of trying to make the getting them scheduled a little bit simpler. But that's a typical um, experience. Is I was thinking it was going to be awful, and it ends up, oh, that wasn't so bad. Like I can do that again if I had to. And then the other thing with the actual procedure, like the average, you know, beginning of the procedure to they're completing it is something like 8 minutes or something. It's not long at all.
Wow.
Yeah,
Okay.
it
Yeah.
like I said, it's. I think society has scared us more than like, and you look at the pros and cons too, right? Yes, is it like embarrassingly invasive? Sure, but is it going to potentially save your life? Yes, and so it's like I think there needs to be more like education, I guess, of people to let them know that this really isn't a big deal procedure, and the benefit of you getting it is so big, right? And so I don't know.
Absolutely.
Yeah.
Absolutely. I agree that I think it's just because it's talking about poops and stuff and somebody having to put a camera and like the camera's not big. They're not using like a GoPro. It's it's an endoscope, right? I mean, it's not, it's very small. I tell people, well, you know, it's much smaller than the caliber of your average poop. You know, like your rear end can take it.
Yeah,
Yeah,
what's that movie in the '80s with Martin? I want to say Martin Short and Dennis Quaid. when
I don't remember.
sorry, I'm just referring, going back, like, the cat, he went inside his body. Anyway, yeah. So yeah, when my GI was describing, like, yeah, I want to do an endoscopy, for you too, since you're gonna be out, and so she describes what's gonna happen, and it kind of sounded scary. And then I said, wait, I'm gonna be out, right? She's like, yeah, you're gonna be out. I said, do whatever you want, you know.
Well, so that's the other thing for people to understand, right? So it's conscious sedation generally, and that means that you are given a medicine through your vein to help you sleep. You're asleep, but you're breathing on your own. You're
Ah,
not you are not on a breathing machine. It's not general anesthesia that would happen for a surgery. This is a procedure, not surgery. Generally, there's not general anesthesia. So and some people choose to do them when they're awake. So
what?
that's important for people to realize too. So it's safer than than a surgery that requires general anesthesia.
Okay,
Right.
so the
I
second, God,
I highly recommend the not being awake. I mean, like I know it's not
Totally.
fully. I know you're not fully out, but like the light sleep or whatever they called it, just so it. I think it just relieves the stress of the idea of what's gonna happen.
Well,
oh,
you can, I mean, people do. So there is in the past, they used to do, oh, sorry, Dr. Ray.
Oh no, I was just going to share with mine. I also had
Dr. Ray,
the.
put your mic closer to you.
I said I was going to also share with mine. I also had the twilight sleep,
What is
and
it? We can't hear you.
okay, let me adjust. Okay, now can you hear me better?
Yes.
Yes.
Okay. So what I was going to say is I also did the twilight sleep and I would recommend that as well. They basically took me back into the procedure room and then just I asked me to kind of roll over. And as I was rolling over, the anesthesiologist, I could feel him with around my wrist about the IV, putting something in there. And within seconds, I was out. And the next thing I knew, I was back in the recovery room awake and feeling very refreshed, very like what
Refresh.
nothing happened. I felt refreshed. I felt like I slept for hours and I did not feel any problem at all. I did not feel like stomach pain, bloating, my butt didn't hurt, nothing. Everything felt very normal, like I just woke up from a nap. So it is the actual having the procedure done is very simple. And if you have the twilight sleep, you really will not feel anything. You will not remember anything. You will not even know anything was done to you at all. So that really is the better way to go. They did tell me that some people choose to be awake, and they say that it's just a little uncomfortable. They can tolerate it, but it's just a little uncomfortable. But otherwise, the twilight sleep is really the way to go. And the procedure itself was not painful, like zero pain, almost negative pain, because I felt nothing.
Wow. Okay,
The,
so
the
okay.
majority of patients who come back from colonoscopy, the majority, they tell me that what's worse is the prep. The prep is harder than the actual procedure, and that's what I want people
Yeah.
to understand. The procedure's really not that bad. It's really not.
So thank you for mentioning that, because let's go to the prep, because that is what makes me anxious right now. How was your
The
experience with?
prep is the prep is going to be the whole point of the prep is to have you poop out all of the poop that is normally in your large intestines so that the colonoscopist, the gastroenterologist, can see the lining and make assessments of it. So it's the whole point of a colonoscopy is to put a camera in and look around at the lining of the large intestine or the colon
Mhm.
and look for any things that look abnormal, look for polyps that can be precancerous, remove them at that time. So they have to have a good view. And so there's many different ways to do prep. So that's kind of the prep for the colonoscopies. So there's many different formulations, and um, usually what they have you do is like a liquid diet the day before so that everything comes out, clear liquids and things. But the prep is really important. You really want to make sure that as much poop comes out. So what I usually tell people is just do exactly what they tell you, exactly, so that the colonoscopist has a good view, and then therefore, you get the best care possible. I have seen patients where I don't think they necessarily did everything they're supposed to. The colonoscopist says, hey, there was too much poop inside. We're going to have to bring you back again to try this again. So sometimes they have to redo it.
What?
Or sometimes, yeah, or sometimes the report will come back to me like, everything looked good, but the prep was only, they call it, when they call it good, they'll say if the prep is excellent, that means everything was fine. But they say if the prep was good or fair, it basically means, well, we saw what we could and we didn't see anything bad, but there was too much poop. So we recommend that you do an annual stool test still with your primary physician, for the next 5 years and come back for a colonoscopy in 5 years or something. So it really depends on, there's multiple factors on what the recommendations were after, but my recommendations are to please make sure you do the prep exactly as you're directed so that you get the best possible result.
Wow. So let's say my colonoscopy is Thursday and this is Sunday.
Mhm.
Um, so yesterday I just had fried chicken because I figured this week people are telling me to start just eating greens. How important is that to just?
What were you told by your gastroenterologist? That's what I would do. Like, I don't want to.
Yeah, I mean I have like this
Like,
like whole page instruction and
it's
like
not that complicated.
it's,
It's funny because like it is not that complicated, but given that I was like, I don't want to mess up anything. I swear I read that 1 page, 2 page, whatever instructions they
right.
had, like over and over and over again. And even as I was going through the steps, I'm like, wait, did I miss anything? Like, because I was just so afraid of that, going through all of it and then being told, well, we have to do it again because, you know, you
Yeah.
didn't do everything correctly. And so yeah.
Yeah.
But I
Yeah.
think that's true though of any kind of procedure, right? Like, I mean, I had
Well, I
surgery.
mean, always follow directions. I think that's important. We give directions,
Well,
not just talk.
Yeah, yeah, exactly.
I mean, there's directions, like 2 days prior, on what you gotta
Yeah,
do.
it's usually things
What
like a low residue diet, which means don't eat a lot of things that are difficult to digest. And I think like the day before, they wouldn't want you to stick to like a clear liquid diet, like, broth and things like that, so that you're not putting more stuff in the intestine.
got it. Yeah, I mean, it's like someone told me like just just eat a lot of salad, days prior, the week prior, and I'm just like, oh no. I mean, does that make a
Well,
big deal?
that's a loaded question.
Not
Macaroni salad and like a tossed green salad are very different salads.
like, the dark green salad, and I'm like, oh. So last night we were just like, what do you want to eat? What do you want to eat? I'm like, you know what? I'm gonna have fried chicken because I'm about to eat healthy all week.
That's not the point.
Okay,
Yeah,
so and then go on.
I ate a regular diet up until the day before, and then the day before just stuck with what my instructions said that I could have, like the clear broth, green jello, um, things like that. And I think that definitely eating less leading up to it means less things in your colon, which when it comes out, it'll be less as well. So I think for me, my instructions were to drink my drink like at 2 p.m. and then drink it again at 9 p.m. And I think between 2 and 9 p.m., I think everything came out. And when I drank it at 9 p.m., there was really just water coming out. There was nothing further. So I feel like it was better that I didn't eat uh, full meals for the entire day. So I definitely ate less, and that helped.
Wow. What about you, Jareen? What was your experience prior preparation?
It was very similar, like reducing what you're eating and then the clear. And like I said, for me, I kept rereading the instructions because it got very as the closer to the to the procedure, there were out like days before and then hours before. So I wanted to make sure that I'm like, okay, I'm not doing anything that messes up the timing, because then I didn't want to be told like, oh no, we have to redo because you didn't
That-
you didn't clear enough.
yeah, I
Right.
remember. Go on.
They definitely want to have a clear view because if they have the fecal matter stuck to the side walls of the colon, they're not going to be able to see or visualize properly and they may miss something. So, as much as you can stick to the prep, as much as you can really follow the instructions and do that properly, it's only going to benefit you because you're putting yourself through this whole procedure already and you've taken the time to do it, maybe time off of work. So you want to do
Yeah,
it properly. So there's no point in cheating it, cheating,
yeah.
things because it's only going to hurt yourself.
Now,
Yeah, yeah. In general, like I mean, if you're going to do it right. If it's not, what the message we want everybody to know is it's really not that big of a deal. The procedure is not that big of a deal. The prep is harder, but it is something that takes an effort. You have to prep the day before and you have to have it scheduled, and just getting it scheduled is a nuisance. I had a patient who was all ready to do their colonoscopy, and they just kind of chickened out at the last minute. And then after meeting with me, wanted to have it rescheduled, and now it can't be. And this is a meeting that we had probably in like I don't know
wow.
May or June. Can't be rescheduled till November, and now they're mad. I'm like, well, you shouldn't have like canceled it. Everybody's trying to get in.
Yeah,
So definitely, like if you're going to do it right and cooperate. No one's trying to hurt you. Those instructions are there for a reason. And commonly what I'm told, is basically is, the preps are usually a liquid most of the time, or there's liquids involved. What's going in should look like what's coming out.
got it. Someone also mentioned a long time ago something about charcoal. Like take charcoal something prior in the prep. What the hell is that?
Do not do that. I can't. I would, not being a gastroenterologist, I would say please consult with your gastroenterologist. But charcoal is, it's carbon. It's not digestible. It's thought to bind and absorb things, and there are certain medical uses for it. But I can only imagine because it is not digested and it is a dark substance that it would only mask whatever they could see in your colon as it gets down to that part of your digestive system, and then it'll make it hard for them to see. So they're not the whole point of the prep is not to it's not to do anything except to get all of the debris out of the lining, outside of the lumen, what we call it, the insides of the large intestines, so that whoever's looking through the camera can see the walls of the intestines and take action as necessary.
Wow.
And
And then
hopefully tell you there's nothing wrong.
yeah, right. Um, I have a question. This is kind of off the side, right? So, in my to-do list, it's like take Miralax. Then I realized that I have a polyethylene glycol 3350 in my. Is
Hmm.
that the same?
Miralax, once again, Miralax is merely a trade name.
Okay.
So polyethylene glycol 3350 or something like that is the generic
Ah, okay.
substance.
Wow. And then so let's talk about post. When can you eat after? Like you go home, you get picked up because you can't drive, obviously. What happens?
Oh, you can eat immediately.
Oh,
Yeah.
really?
As soon as I came out of recovery, and then they were like, okay, wait like 10-15 minutes and made sure I was good. And then they put me in a wheelchair and put me in the car, and they said, you can eat whenever you feel like it. And so on the way home, I made my daughter stop and get some breakfast for us. And by the time we got home, we sat down and ate. So probably 30 minutes after I left the facility, I was eating, and they said that was
Right.
fine.
There's no cutting of anything, like it's not a surgery, so you can eat. There's no reason to think you're obstructed. When they do have to do biopsies, which is really common, if there's any polyps, they'll be taken out during that time. or sometimes they'll do, depending on somebody's. So remember that we are talking, I think we should clarify these things, right? We're talking about screening colonoscopies, which is where somebody's fine, I am well, I don't have a significant family history of colon cancer, I'm just of age that this needs to be checked. That's what we're talking about. That's a lot different than a diagnostic colonoscopy where somebody say, hey, I'm 32 and I've been, pooping blood for 6 months. That's different. So I do want to emphasize that. But in general, none of those things. First of all, it takes hours for the food to get from when you eat it to the intestines anyway, but there's no restrictions usually. Usually they just kind of want you to take it easy and have somebody hang around just because the sedation afterwards. But you can essentially, just kind of take it easy the day of, and then the next day you can just go back to your normal activities. Some people complain of, some residual gas and bloating. They use um, gas, carbon dioxide that's pumped in through the endoscope itself to kind of open up the way a little bit. And that's sometimes people will have a little bit of gas or bloating. Sometimes, if there's any biopsies or polyps that are taken out, there might be a little bit of blood here and there, and that's normal. They'll give you very clear instructions afterwards, depending on what is found on what to do. But it's a simple procedure, and you can generally go back to your normal activities, normal diet at least after.
Got it. So, if you get when you get a colonoscopy, expect 2 days off, basically. The day prior and the
I
day
don't
of.
think you have to take the day off. I mean, I think you can.
Really,
I
people?
don't, depending on what you do. I mean, I don't think there's a whole lot. I mean, I think it depends on the time of day that you have it scheduled, and there's a million reasons.
Dr. Ray?
Well, I worked half a day of my prep day because I needed to start the prep at 2 p.m. per my doctor's instructions. And so I had the full 12 ounce of liquid that I needed to drink, or 16 ounce of liquids. And at first, like the first 30 minutes, I was like, oh, I don't feel anything. I hope this thing works. But when it kicks in, you need to go to the bathroom quickly. It's not something that you can hold while you finish your work task, or answer phone calls or something. It
Yeah.
was like when it hit, I was like, I need to go to the bathroom now. I was on my living room sofa, and my bathroom, is near. And every time I felt the need to go, I felt like I just barely made it, because remember, the first one or two times you go might be solid stool coming, but then after that it's going to be very liquidy, very watery, and it's going to be harder to hold in when you feel the urge that you need to go. So I would say, I think when you're doing the prep, that I would say that you need to be home, and or very close to a bathroom, have that ability to go. So again, I don't, if you work from home, maybe you can continue working that day because you're near the bathroom. But if you have a job like a waitress, or
Delivering
construction
baby.
worker, delivery person, no, you definitely need to be within 10 feet of the bathroom as soon as you
Yeah,
start your prep.
All right.
And
So,
then
you can't work when you're prepping. That's not
No
gonna that's not gonna
meetings.
fly.
No work
no,
meetings.
no meetings. So,
And the other thing, so that we don't scare people, right? The other thing I do want to, the truth of the matter is the prep is not, it's not crampy, painful. I have to go. It's usually just kind of described as like a stool urgency. Like I have to go, and I have to go right now. Get out of the way.
okay. So this is not legal advice, but if you get caught speeding, just say you're having your colonoscopy tomorrow. No.
They might just let you poop your pants. Good luck.
yeah,
Don't start your prep while you're on the road. How about that?
All right. Well, you know what? Anything else we can
Oh,
talk about? Uh,
I would want to point out one thing just in case somebody makes some wild assumptions. The endoscope that's used for the colonoscopy is not the same instrument that's used for the endoscopy.
oh,
Just
okay.
FYI. Some people ask that. They're not going to take something that goes in butts and then put that down your throat.
Yeah. Yeah. This is a stupid. I mean, it's between friends, right? So, You mentioned like, okay, if you didn't clear your intestines, the right way, don't they? Why don't they have a device that just kind of vacuums it out? When
They do suction. There is suction during the colon. If they have a little bit of stool, they will suction it out a little bit, but they can only suction out so much.
got it. Okay, another question
'Cause
is,
remember, the endoscope is small. It's not. It's maybe like finger width. I don't know. I haven't handled one in a long time. They're not very big, so they can't. Stool is not necessarily soft and pasty, and so they can't necessarily get all kinds of debris out of somebody's tushy. So it's not really designed to do that. The bigger I would imagine that the larger the diameter or something is, the more uncomfortable it'll be, or higher risk or something like that.
another question is like, do people feel like skinnier after?
Why would they feel skinnier?
You lost so much.
I
No,
wish.
What?
you'll be missing a day's worth of massive calories if you normally eat massive calories, but no, you may feel a little bloated afterwards, and that's normal.
Bloated.
I have had a few patients with some delayed return to normal kind of business, but the majority of people are like, yeah, it's fine. Everything is fine. Well, it's bloated. Remember, the bloating is because they are injecting gas into
Ah,
to open up the intestine a little bit. So it takes a few hours for that to clear out. And it's safe, it's normal. It's that gas is not any sort of anesthesia gas. It's inert to help open up the intestines so that they can see what they're looking at.
got it. Okay. Dr. Ray?
Yeah, I did not feel any bloating afterwards or any pain at all. And while I was sitting in the recovery room, I was like trying to assess like, okay, how do I feel? What are my symptoms or what's going on? And I felt nothing. Even my again, this is, we're friends. So even
Yeah.
like my hole did not even feel sore. I was thinking like my butthole was going to be sore,
Yeah.
um, but it wasn't. Did they even do anything? Like, no,
Remember that the diameter of the flexible endoscope that's used to go in is way smaller than the average poop.
Wow.
right.
So
And
it's small. So it's
so
not going to
again,
distend anything.
yeah, so again, it's not painful at all. It's like zero pain. You feel like nothing happened to you. I did not feel bloating. I did not feel air. Maybe I, had a good fart at one point,
Yeah.
but after that, like by the time I got into the car, I was like, I feel perfectly fine. I feel like I just
Uh,
woke up. I feel well rested. I feel zero issues at all. All I am is hungry, and we need to find some food now.
so
And that was it.
you didn't
So
walk
she was just
differently.
angry.
Yeah.
You didn't walk
And
differently.
Oh
yeah,
my gosh.
I did not feel lighter as far as weight goes. Maybe my stomach felt a little flatter. Um, like when you wake
Wow.
up in the morning, it's kind of a little flat because you haven't eaten for a while. So maybe my stomach
Empty.
felt a little bit flatter. And then, I started eating that day like normal, and it takes maybe about 24 to 36 hours to have your first bowel movement after that. And then my bowel movements were fine and not affected at all. So it honestly, the procedure itself is very simple to do, and I would have no hesitation to do it again. The prep was challenging, just going to the bathroom frequently, feeling the urge, like I have to go to the bathroom and trying to, get to the bathroom as soon as possible to go. And at some point during the prep, which is supposed to happen and is good, it feels like, a hose is coming out of your bottom and it's just water coming out,
Yeah.
and it's nothing solid. It's just pure water coming out. And, maybe you feel just a little crampy just because you're going a lot. And, but other that wise, nothing else. One little tip I will say that I've learned from my patients that have told me is that, wiping with the toilet tissue is rough on your bottom, and to do it so many times, during the day, you might go 10 to 15 times. So in between, use a little Vaseline and put that on the outside anus area in
Yeah.
between, so it kind of soothes it, and use like the wet wipes as well. The wet wipes are a little bit gentler, because I think a lot of the discomfort or irritation comes from just the chronic wiping, because most people have maybe 1 or 2 bowel movements a day maximum, but you're going to have like 10 to 15 in like an 8-hour period, so the cleaning yourself gets a little uncomfortable. And so putting a little bit of Vaseline on in between, and just being more gentle when you clean yourself, or using a wet wipe or one of those flushable wipes
Uh-huh.
will make it more easy.
Wow.
Yeah, I'm imagining a bidet would be a really good thing. And then also, it's just like it's like little kids, when they catch a cold and they're wiping their noses with Kleenex 15 times, an hour, they all of a sudden have a red, irritated, scratched up little nose. It's the same thing for the tissue. So just be
Yeah.
gentle.
So Vaseline, not Aquaphor, right?
Same thing. You can use
Same
Aquaphor.
thing. Okay,
Well,
interesting.
not really the same thing, but
Yeah,
similar.
same things. I got someone here, Um, wow, that's really good to hear, and that's really encouraging. So I guess next
Most
week,
people find this not a big deal.
yeah,
Most people find this is not a big deal. It's more of like a scheduling issue and a time off issue. The actual procedure is not that big of a deal. The prep is generally considered more challenging, but once again,
yeah.
you've pooped many times in your life. If you have to do it a little bit more, you'll be just fine.
Well, okay. This doesn't really apply to me because I don't really drink alcohol. Um, when can you drink alcohol after the procedure, or stay away from alcohol a week prior to the procedure? Like, is there anything about that? People that drink alcohol.
I don't recall them telling me anything about alcohol, to be honest.
Oh,
Yeah,
The
well, alcohol is not that it doesn't create poop, so that's not a big deal. The only place where I can see it as an issue is you don't want alcohol to mix with the sedatives that they use to sedate you, but
yeah,
those things are all so short-lived. I mean, maybe not go into the procedure drunk.
yeah. Right.
Don't
right,
have a
yeah,
couple
don't do
beers with
that.
me.
Yeah.
Okay, I'm between friends. I've got to ask this to Dr. Ray. Did you know the doctor that was doing your procedure, the nurses?
So no.
Good.
So I delivered my babies at my hospital with all my nurses and doctors and everybody that I knew, and I didn't have a problem with that. I was like, I've seen, as an OB-GYN, I've seen now, I don't know, maybe 20,000 vaginas. It does not faze me at all, and I was fine with it because I know nobody's like, nobody's thinking of anything. You're thinking of getting this baby out or doing what needs to be done. You're not thinking anything. But when it came time for this, I don't know if it's because I'm older or what, but I was like, I don't know if I want this to be at my hospital. It was not so much with the GI doctors, because I don't interact a lot with them, and maybe I see them very rarely, so I didn't really mind. And I know for them, they do thousands and thousands of colonoscopies. They could care less what my butt looks like. It was really like the anesthesiologist that was going to be there when I kind of thought about it, because the anesthesiologist I work with a lot because of my surgical cases.
Uh-huh.
And so that I thought, maybe that might be a little weird. So I went to it. Luckily I have a PPO. I went to a neighboring hospital, and I didn't know anybody there, and had it done, and I was comfortable with that. So, it's everyone's preference of what they need to do. If I had to do it at my hospital, like if I had an HMO and I had to do it at my hospital, I would. Again, they're all professional. They've seen all these body parts thousands and thousands of times. They just don't care. I mean, I'm going to tell you that flat out. I've delivered, many friends. I've delivered my sister. I don't care. I don't even know what I'm looking at. I don't even care to look at it. My mind is, what do I need to do in this moment to make sure this baby comes out safe? What do I need to do medically speaking? That's where my brain is.
Well,
So
I think
Yeah, we as physicians
we
don't
can
care
talk.
about that stuff.
I think let's
Yeah.
do that for the next episode. That's good. You know, what do doctors not care, and what should patient
Not accessible.
not
We,
be
Take
cared
notes.
we,
about?
we
We take
do
notes for
not
that.
care about a lot of things. Let me tell you, we do not
Oh yeah,
care about a lot
totally.
of things. We really just want to solve the one problem that you came in for us to solve, fix it, and move on to the next patient. So we,
One problem. That's where I have an
yeah,
issue.
So,
it's
If
between
it were
me and
only
you.
one.
That's the difference between me and you. Yeah. Um, yeah. Patients, they apologize all the time. Oh, I didn't shave. Oh, I didn't get a chance to shower. I didn't do this. We do not care.
All right, we'll talk about
Totally
that
don't care.
next week.
yeah,
I think unless anyone else has anything to say about getting your getting colonoscopy, we'll end it here. All right.
Great to talk to you all to you today. Really happy.
Thank you.
Fantastic. Thank
Thank
you,
you.
everyone.
yeah.
Hold on.
Thank you. Bye.
You're listening to Between Friends, Doctors and Friends. Bye.